Welcome back to Spooks, where we bring different groups of friends together, one story at a time. It's MBCK Corner, and it's Charisma.
Brenda. Lolly.
Mona. Oh,
All right, so Lolly, please start us off since you were the one that picked the
okay.
book.
I chose this book back in November, so
Yes, it's been
it's
quite
been a
a
while.
bit.
The People's Hospitals, Hope and Peril in American Medicine. So essentially, I chose the book during that time when everything was happening with residency and stuff. I thought it'd be a really good idea to basically have a better perspective or understanding of like the American healthcare system. It's broken up into like four parts. It goes from sharing the stories of like individual, like their story and like their struggles and how like they navigate the healthcare system, while also diving into from the patient's perspective and from like the doctor's perspective. And then there's a third perspective coverage of like health insurance. That's basically the gist of the book from what I remember because I read this a while back. Let's see. I rate it a five. I think this has definitely become my favorite book. From the beginning, I loved it. I was already crying in chapter one. The way the author goes about writing it, how he is as a doctor and like what he feels. What I struggle to say in words, he says it perfectly in this book. I like highlighted a lot during this book because I related to like many of the things that he was saying. Like it just like in my head, it was like, you know what? What? He's so right. Let me read you a quote. Let me read you a quote because I don't remember exact page. But basically when he talks about how he feels when like he asks the patient, do you prefer if I speak to you in English or Spanish? The way he goes about describing that, the change in the reaction when they realize, oh yeah, you can speak the same language as them, and the way he wrote it, it really clicked with me. I feel the same exact way whenever I speak to patients in like Spanish. That was my rating.
I read the book on my Kindle. Yes, I also give it a 5 out of 5 because I learned a lot. My knowledge of healthcare was based on my experience, but even based on my experience, I know how difficult it is to even acquire healthcare. So, considering other people and the positions that they're in and seeing all their stories and how crazy all these rules are, it just like blew my mind. Yeah, I feel like this book is like a very important one for people to just get educated on. Everyone needs healthcare. We can all relate to one way or another. And I remember you said that when you picked this book. There were so many quotes that I highlighted as well, so many points where I was like, oh my God, like that happens.
Up next. I started out reading it on my phone, and then it was coming closer to the time that we were going to meet, like the first time. And I was like, dang it, I don't have time. So then I got Audible. So I listened to it because I'm a mother, I'm busy. I mean, we're all busy. Not just moms can be busy, I promise. I rate it a 5 out of 5. Books with a lot of scientific terms can be like hit or miss for me, but I really liked it. I understood it. It was pretty easy read. I wouldn't say I'm like in the medical field, but I'm kind of sort of am with animals and whatnot. I thought it was a really good book. I didn't highlight as much as I wanted to because I listened to it, but there was a lot of times where I was like, oh no, gagged. I'm sure we've all struggled with freaking health insurance. I'm currently uninsured, so off the record.
So I read it on a Kindle as well. Like all of you guys said, I would rate it a 5 out of 5. I feel like from the beginning when I started reading it, like I already knew it was going to be a very informative and great book. What's different about this book, I guess from science or medical books, is that we're talking about people's stories and their experiences. As someone who wants to work in like healthcare, like, that's our main focus. We're not here for the money. We're here to heal. We're here to understand these people because we're in a place where they're not. Reading this book kind of just reinstated like the privilege that I have being born here, having health insurance, and knowing that like people out there don't. You can learn how to be a better provider, how to be a better human, even if you're not directly wanting to work in that field. This is us learning to learn about microaggressions towards like people of color and what they go through on a daily basis and how you can use your privilege to advocate for them. This just kind of helped me like, yeah, this is exactly why I want to work in this field. I'm very much like interested in like global perspectives on health and like I want to dive more into that in my career. So this really helped me like expand my worldview. I appreciated like having this book, in my library.
Period. I was wondering if you guys could share more about your perspectives being in the medical field or like studying medicine and reading this book and stuff like that. Yeah, I'm in the arts. I'm nowhere near medicine. So I found it like really interesting seeing your guys' perspectives and,
You're not nowhere near medicine, you're a patient.
yeah, that's the thing. Like I could only see it from the point of view of the patient because that's where my family members have been. That's where I've been. I could only see it that way, but you guys could see it both ways.
I think the book gives like a different perspective. Definitely. Like me and Mona graduated with health science, so we took classes that talked about like the healthcare system. We talked about like efficacy and policy, and we took those classes. And I think it's definitely different reading the textbook with statistics and data and like straight to the point. And then it's also something completely different, someone's actual life situation, circumstances, and like what brought them there. And I like this book because it was holistic. Like it showed the healthcare aspect and then also the personal like complexities of like each character. I'm a medical assistant, so I'm not a doctor. I'm not like a nurse yet. Um, but even now, like reading the book and like my experience, like working in the healthcare field, I realized like my hands are tied with certain aspects. Yeah, there's certain situations in my workplace where like I can help the person, like am willing to help the person, but there's protocols and rules in place that limits me to help them. It's hard to like make that distinction between like, does the doctor want to help me or the doctor just can't help me? I think in the book, Roxana, she was like the woman whose like fingers and limbs, they were basically dead, but they were still hanging on her body. And like the surgeon performed like this miracle surgery because she had like a really bad tumor like in the back that was like affecting her heart. And then afterwards she couldn't get someone to like amputate her like limbs. There are over like 100 something perfectly suitable surgeons within a mile or two, yet no one can help her because of the rules and like regulations that are in place. I don't know, I think it's definitely like very complex, wanting to help and being able to help. I feel like it's a book that a lot of healthcare professionals should read because medicine isn't just about treating the patient. It's about looking at the whole like picture because like, okay, yeah, you treat the patient and then you send them off. How are they going to pay for that bill? I guess the expenses behind it, like health insurance, like health policies. Yeah, that was my hot take.
The biggest thing I learned was a patient that's in a state of emergency, once they're out of that state of emergency, and if they were to become chronically ill, there's a whole different set of rules that the doctors and healthcare providers have to follow. Like with Roxana, with her limbs, they couldn't amputate it because there was a set of rules that they had to follow since she became a chronically ill patient. She was no longer in the state of emergency. Learning about that was very new to me. Like I didn't know there were so many like intricate rules. That was just crazy to me.
I'm not really like in human health. I'm a veterinary assistant studying to be a licensed vet tech, which is basically like a nurse for dogs and cats and horses and any other animal you can think of, besides bugs. I get that question a lot from my dad. Don't know why. I was in the ER and ICU at an animal hospital. It was like one of the three of specialty centers. My hospital and another hospital in the city were the only ones with like MRIs and stuff. We mainly take care of dogs and cats, but a lot of people didn't get insurance for their pets because no one really thinks of them like that. Pets are considered property. They're not really seen as like a being. There are some people who do get insurance for their pets, but it's usually after like something crazy happens or whatever, where someone tells them like, hey, you should get insurance. People don't come in until the pet's showing signs of discomfort or signs of injury or signs of just like death. It's very sad and gruesome to like see all these things. I'm the one that like has to go in and get the histories and find out all the information, and everyone usually has very long story of how their pet got here. Like, so I said, like, there's a lot of times where we can't do anything unless we have consents or money or things like that. And since, insurance for pets doesn't work the same way as insurance for humans, owners usually have to pay up front everything and then they receive a percentage back from their insurance. A lot of people didn't have money to pay, didn't want to pay. A lot of people were just be like, okay, like, can I just euthanize my pet? Like, a lot of people were struggling. Animals don't have insurance, and like I see that a lot that the doctors like do their best to kind of like bring the price down, or like I just won't charge the consultation, I won't charge the euthanasia, I won't charge this because people don't really have money to do anything otherwise.
I'm like gathering like all of your stories, so I'm just like I don't know what direction or what to talk about because you guys like brought up like a lot of good points. We were talking about providers and like a lot of providers kind of just like want it to be like a quick fix or like come in and get out type of visit. When you're a provider, you really have to focus on like who's in front of you. One patient, one doctor. That was like a quote that was in the book. It's just sad to see that people who are uninsured, have to pay like exorbitant costs just to get something very simple done or just checked out. And it's just like, why? Why do we do that? I took psychology of women's health in college with women. Sometimes they'll come in and report having like pain or like women that might have had like postpartum and like they're going through a lot of deep emotions and doctors will kind of like rule it off and like, oh, like you're just experiencing mental health issues and kind of send them off to like a psychiatrist and then put them on medication. Like you're not really sitting there and understanding why they're here and what's their reason. And you need to really dive deep into like your patient. You need to sit down and take that time. That's just an example. The more we put like a label on basic emotion and feelings and like, you're stacking up the cost.
I think like the whole premise of this book was also the healthcare system is essentially just a business. Prisma also said to like share a quote. For me, it was the primary goal of healthcare is to generate income for providers. Other goals like preventing sickness and empowering people can happen, but only if the first goal is met. When I read that, I was like, damn, spitting facts. And this is coming from a doctor, which is crazy.
That was the one that I also highlighted and wanted to talk about. This is very known amongst everybody, but the fact that it's coming from a doctor himself as well, and the fact that we just kind of have to live with it, even though we know why. Why can't you do something about it? The other quote where he says, empathy is the foundation of effective healthcare. I feel like you don't need to be like money hungry all the time. Like people's lives don't have to turn into something that you always need to profit off of. I know it's a difficult job, but then it shouldn't turn into a business. It's just inhumane. And this is me speaking from the patient's side. Like, what is this? What are we doing? What are we doing?
What are we doing here? I took public health courses during senior year. One of the things that we focused on is like statistics of people of color and the health like inequities and disparities that they face. One of the things that was mentioned here was how African American women face birth mortality rates and how their children have adverse outcomes. And so it's one thing to learn it in class and then it to be like read in a book. These are the pressing issues that we really need to focus on. Why do women of color face these rates? You would think that American healthcare is the best on how much we invest into it. But in reality, given the experiences that we have had, that we have heard, and that we have seen, it really isn't. The amount that we put into is not the amount that we get back.
It is the most advanced than other countries. It's just like a matter of the country's morals, I feel. They see their patients as dollar signs rather than actual humans that they need to take care of. And yeah.
Another thing is that one of the things I'm very, very like passionate about is we should try to focus on prevention rather than treatment. I think both go hand in hand, but the reason why people are getting sick, they wait until it becomes so worse that they have to get treated. I think education and prevention is just one of the best things that we can do for our health. One of my goals in the future is like I want to be able to have one-on-one with like my patients and help them get to a stage where they can maintain their health rather than escalating issues and finding them in a situation where they can't pay for certain costs.
Science fails to realize like how different everybody is based on like where they grew up, where they come from, and all that kind of stuff. And like that's kind of what I liked about veterinary medicine is that like each breed, each animal, even like the different sexes, like they're all studied because their bodies work differently. Like if it hadn't been studied, like you couldn't never know that cats are true carnivores, but dogs are not. Dogs need other nutrients. Although, we're all human, most of the studies are based off of white men. White men doesn't cover everybody.
We kind of cover like health insurance and their individual stories and stuff. But I kind of want to talk about like a hospital in general. The fact that it's like a safety net hospital and that they're doing what America in general is struggling to do. They've managed to emphasize the needs of the public than like those on like a chair board committee or whatever.
Mona, what you said about prevention rather than treatment, I think that's very important because a lot of people, and speaking from experience from my family or me, if there is like something wrong, we try our best to not go to the doctor if we absolutely do not need to because of how past visits went and like some certain comments that were made from the healthcare providers and all of that. It wasn't a place where we felt we could be vulnerable about our health and what we were feeling because we weren't really taken seriously. And I feel like that's an issue, not all of them, but in a lot of places. Although we do have health insurance, it's pretty hard to find a doctor that is under our insurance that is actually like willing to help us rather than seeing us as a person that he could profit off of.
I 100% like agree. As like someone who has been the patient, someone who has been a family relative of the patient, like I know exactly like that feeling. Like I like my job. I'm very fortunate because it helps me see the other side. And I've seen that like on patients where like the provider just doesn't have anything else to offer, so he just brushes it off. And I know the look. Like I've seen it in patients, and it's just like reinstates like that feeling of like that's not the type of like provider that I want to be. Like I never want to have that look on my patient's face where I'm just dismissing whatever they're feeling because it's an awful feeling. You're a public health server. That visit, it should not benefit you. It should benefit them. These people who come into the office, they're probably taking a day off of work. Imagine that, taking a day off of work for you to just be like, it just goes back to what kind of healthcare provider I want to be and the type of system that I am forced to work in and how I have to basically go about navigating it and helping my patients.
Growing up, I never broke a bone. I never had any like serious health problems. My brother did, but we had like pretty good insurance. Like I don't remember ever having like real problems with our insurance. But then like, getting into a relationship and then with Eduardo and like seeing his reactions to when he would get injured, like, he had a really huge cut in his hand. I'm just like, you need to get stitches, like you need to go to the doctor. Like he was like, no, I don't. Like it'll just heal. Like I'll just have gnarly scars. Like it's very different. Like now I had gotten insurance because I was pregnant. And then a month after I gave birth, my insurance was supposed to be renewed, but it got denied because I was no longer pregnant. There's an option like signing up for like Medicare, an adult taking care of a child, which I am. But I still get denied every single time, even though I have no income. But children get insurance, so Dylan's fine. But as like a mom, I mean, I'm a year postpartum now, but like God forbid anything had happened to me, after my first couple months. But yeah, like it's tough out here.
I really like this book because as someone who has never faced major health issues, thankfully, and has had health insurance like since I was born, I've been taken good care of, this book really helps me see that there are people that don't have that same privilege as I do. It's a very informative read for us to kind of like unlearn our preconceived notions and microaggressions, how we can be better people and how we can be better providers if we so choose. Where I work, I don't deal with like heavy medical conditions. I do deal with certain conditions that do warrant a little bit more like involvement. But regardless of the fact, we do see patients that come in and don't speak English, and sometimes they need a translator. And it's very important that we have like somebody on standby who can speak Spanish or another language for them to understand. Health literacy is something that needs to be focused on.
The food over here, like the processed food or like the preservatives, everything, it's just like terrible.
Americans should really stop eating like their healthcare is free. I don't care if this offends the people who are watching this because
That is so real.
You got that off a red note.
I am a firm believer and supporter of it. 谢谢 to all my Chinese people.
Shit.
I'm Chinese, don't worry, guys. Oh, yes. So,
Yeah. Oh, the dog. Oh, I love her. She's so big now.
special guest.
All of our conversation, it just shows that it really all comes down to what the country prioritizes, and it's just making profit, and it's not really about its people or anything like that. And that clearly shows from the quality of the food that we have, health insurance, and everything else.
I don't know. I don't want to jack, like,
Yeah, overall, everybody should read this book.
Yeah.
It's very easy to understand.
Healthcare providers definitely should read this book. I know y'all busy, but whenever you get the time, listen to it or something. Sympathy is very lost in a lot of healthcare providers. You're working with real people with real feelings. Read it.
Like Chris Mann said, it's really easy to understand. It's straight to the point. If you're someone who learns off of people's experiences, I feel like this is a great book. Like a great balance between personal experiences and like facts.
I think healthcare providers, anyone who wants to work in medicine, just anybody who just wants to elevate their knowledge, this would be very good for you to understand what it means to be a provider, how to cater to your patients, how you yourself as the patient can advocate for yourself, because that's just very important.
I almost forgot to announce the next book, but the next book is White Knights. Dostoevsky is the author, and the reason why I picked it is because it's been on my reading list for quite a while, and it's winter, so it kind of fits the season. And it's just a short story about a young man fighting his inner restlessness. And it's a narrative, and it delves into the torment and guilt of unrequited love.
Oh, unrequited love. That sounds so sad.
That's it for today's MBCK Books Corner. Keep reading.
And we'll see you
And the next
Chapter.
Thank you, guys.